what does an actual acupuncture treatment for your child look like in the clinic? So before we even get into the clinic, I will have a phone consultation with you where we talk about what your child is going through and, what other modalities they've been using and what you're hoping to get out of treatments and all of that sort of thing. And then I'll email you an intake form, a very thorough intake form that you print out, fill out, and bring with you with your child to your child's treatment. So I will, once I meet you in the office with your child, I will go over the intake form, and then we do a very thorough health history questionnaire where we just talk about all kinds of things related to your child's health, their physical, emotional, everything, their diet. We look at a lot of different things. And so this whole time, depending on the age of the child, either you, the parent, will be answering all the questions, or if your child is older, they can answer the questions, or it can be a combo of the two. You answer some questions, the child answers some questions for me. So your child will be a part of the process. It is their treatment after all, and so they'll be in the treatment room with you. And if it's a younger child and we're going through the health history questionnaire, it's totally fine if you bring a toy for your child to play with, to kind of keep them occupied while we're going through the health history questionnaire. And then again, depending on the age of the child, we will then do a demonstration on what acupuncture looks like. We call it TAPS for kids. That takes the stigma out of the needle part. Instead of calling it acupuncture, we call it TAPS. So we demonstrate TAPS to them. And, if they're in the ages 4 and up, we'll demonstrate TAPS and let them know, that they can choose whether or not they want to try it. For kids younger than that, I'll show them TAPS. I usually will just demonstrate it either on myself, or if the parent is game, I will demonstrate it on the parent so that the kid can see that it's okay, and then we can do the TAPS on the child. So we always do a demo, and the child can decide whether or not they want to try it. I never force a child to try acupuncture if they do not want to. So if that's the case, then we use the other tools, whether it's the lasers, the microcurrent, the massage, herbs, whatever else we need to do. We can always treat the child whether it's with needles or not. So then we do the treatment. The younger the child, the less time they need to rest with the needles. Really young kids and babies, the needle goes in and it comes right out, and we only need to stimulate 1 or 2 points on really young kids. So their actual treatment, once we go over the health history, it's actually pretty quick. So for older children, their treatment might be a little bit longer, and we make allowances for that as far as the schedule is concerned, but it still doesn't really take as long as an adult treatment would once we get past the health history. The health history part can take a little bit of time because I like to make sure that I know exactly what's going on with your child and we can do a correct Chinese medicine diagnosis for them. So once the actual treatment part is done, then we can talk about some homework and self-care and things that you can do at home to help make your child feel better and help further promote the benefits of the acupuncture or the TAPS that they're receiving. And so that could be some dietary changes, or taking herbal supplements, or taking other supplements. It could be, changing things in their environment, where they're sleeping, or, if they've got bad allergies, we can look at triggers, that sort of thing. So I focus on the child as a whole, including how they interact with their environment. So I give feedback and advice that will help the child just thrive overall. So they get the actual treatment in the office, and then we talk about homework, and that's pretty much it. Then you guys go about your day. So as far as what to expect after the treatment, most kids feel pretty good pretty quickly. A lot of them notice the results right away, as far as feeling calmer and less stressed. And most kids kind of just want to go take a nap afterwards, although some get more energized and they want to go run around, which is fine. They're both normal. Everybody responds a little bit differently, but either way, your child should start noticing some improvement right away. And then we stick to the treatment plan, whether it's once a week, twice a week, for however many treatments. It differs depending on the child. But we go over the treatment plan, and then they just come in regularly for their treatments. And every visit we reassess and we evaluate how your child is progressing. We do the treatment, we go over any, dietary changes or whatever else needs to be addressed, and that's it. So the first visit is about an hour, maybe 75 minutes if it's an extra complicated case, like if it's really like a bad case of asthma. But then after that, follow-ups are about 15 to 30 minutes. So they're actually pretty quick. It's like in and out because kids don't need as long. So that is an acupuncture treatment in the office for your child in a nutshell.